Hello, everybody. Welcome to this webinar on the punctuated equilibrium model for influencing public policies. My name is Marianne Jacques. I'm a scientific advisor with the National Collaborating Center for Healthy Public Policy, and I will be moderating the webinar today. Just before presenting the team that is here with me today, we'll just take a few minutes, not a few minutes, but a moment just to make sure that everybody hears us okay. If you have trouble hearing us, please write so in the chat box, and we will make sure to adjust our sound. If you have any technical difficulties, please also use the chat box to indicate your problem, and we will be we'll try to support you as best we can. So I'm gonna just move to our presentation. Just a reminder, you have the numbers here on the slides. If you are on the webinar platform, you can connect with these numbers for the audio. So our team for today's webinar, so myself, Marianne Jacques, I will be the moderator for the session. We have Mylène Magloire, who's responsible for logistics and technical support. So if you have any issues, she will be the one supporting you with that. We also have in Montreal Mathieu Jolica, who will be a presenter for today. And we have Jennifer Levy, who's in Toronto, joining us as well for this webinar. So throughout the webinar, we invite you to use the chat box to ask any questions you might have. I will consolidate the answers and raise them in the Q&A period after each presentation. So because there's a lot of people on the line, you won't be using the teleconference line for questions and comments, but please feel free to use the chat box, and we will go about it that way. So this webinar is accredited by the University of Montreal's School of Public Health. Speakers have, both Mathieu and Jennifer have indicated that they have no real or potential conflict of interest related to the material that is being presented today. And so just before we move into the content of the session today, just a bit of context about who we are and the work that we're doing around public policy. So the National Collaborating Center for Healthy Public Policy, or the NCCHPP, is part of a network of 6 collaborating centers financed by the Public Health Agency of Canada. Each center is located in across Canada and works on a specific public health topic, and we all share a mandate of knowledge translation on those specific topics. The NCCHPP is hosted by the Institut National de Santé Publique du Québec, Quebec's Public Health Institute. We are located in Montreal. And so the NCCHPP is a center for sharing knowledge and expertise in the area of healthy public policy. And our specific mandate is to support public health actors across Canada in their efforts to develop and promote healthy public policies. So today's webinar is part of our work around the various models used in political science to represent public policy processes and discuss how these models can serve as a lens to guide public health action on public policies. So, moving my slide. So, today's webinar will introduce the punctuated equilibrium model. Content of this webinar is based on a briefing note wrote by Mathieu Jolica. So he will be presenting the main features of this model and discuss potential implications for public health actors. We will then have Jennifer Levy speak to Toronto Public Health work on healthy public policy, and she will share a bit of insight in terms of the usefulness of the model for their public policy work. So now I will stop here and I will hand it over to Matthew.
Well, hi everyone. First, I would like to say that I'm glad to be here and talk to you about this theory, this political science model. And a part of my work, as Marianne said, I wrote a briefing note about that you can find on NCCHPP, which in English is NCCHPP. Or am I right? Yeah, right, I'm right. So first and secondly, I must apologize for my English. It's kind of bad because I'm not used to work in English. So please accept my apologize for that. I'll try to be very concise about the theory that I will show you. Before going on the model and the icebreaker, I must just take 2 minutes to introduce myself. So I'm working with in a policy public unit in Montreal Regional Public Health Department. So I'm under the deputy director of the Montreal DRSP, and we provide her and our directress with context analysis, background information on public policy. We participate in a lot of drafting on advisory and white papers that we can provide to certain decision maker. And we have also a role in strategic scanning and also in media watch to see what's going on in that can be an issue for public health. We give to a lot of professional also support in influences and intervention in with strategic actors. And we have, it's our 5th years now, we have a community of practice on public policy related to health. So that's the 5th years we start now. And so we try to, with that community of practice, we try to improve the overall knowledge of professionals in public health about public policy. So in my unit, I work with 2 other persons, one of which is a former director of public health. So before that, I will just ask you a brief icebreaker. So if you can just say, where do you work? So, oh yeah, it's still moving. So I will leave you a minute, well, a few seconds. Well, it's mostly like the registration data that we were having. So mostly people came from Ontario and a little bit from the West Coast. So glad to hear from you, and I wish you will have questions about our model and the work we do here. So we just start with well, that's not really the attendees, but more the registration data that we had last week. So a lot of people work in local and regional government, but still there's a lot of other kind of provincial government, federal governments are part of the attendees, I guess, and university also. So welcome to every one of you. A lot of people say that I was kind of impressed with that. A lot of people say that there's public policy development in their work, so that's kind of nice. And we were also asking yourself if you have, if the registered person were having knowledge of public policy influence. So I was kind of surprised also that something like 2/3 of the people were having good knowledge of policy, public policy. Still 1/3 have a low level of knowledge policy. Here we will find a theory that's kind of that's not really the mainstream theory, but still a very nice theory, I think. And when we dig a little bit, we ask from where did you get your knowledge? And formal source was the main way to get knowledge. A lot of people have also like practical experience. I would like to dig that with the formal source are the work of NCCHPP are used as one of these sources. That could be very nice to see. So now we start with the main feature of the presentation. So it's the equilibrium theory, well, punctuated equilibrium theory. So that's the real business of today's topics. So, well, first, the model was first published in that book, Agendas and Instability in American Politics, that's been published in 1993. Well, that's not really true because first there is a paper in the Journal of Politics that was called Agenda Dynamics and Policy Subsystem in 1901 that was on that same topics, but this book is the real business. And in that book, they try to analyze five major subsystems over a very long period of time, nearly 90 years, a bit less or a little bit more, depending on which subsystem we were talking about. So there were 5 subsystems: tobacco industry, auto safety, nuclear energy, pesticides and agriculture, and municipal urban planning. So there's also a new edition of the book in 2009 that Frank Baumgartner and Brian D. Jones published, and which develop a little bit on their first insight with punctuated equilibrium. So first, before starting with the theory, I must just start with put on hold on the theory and give you some insight about subsystem. So subsystem is very important when you think about punctuated equilibrium, because that's how they see the politics. So subsystem came from pluralism, which is in political science, it's a way of analyze the society. Well, mostly pluralism say that society are diversified and there's different group in that society. So to study the society, you must study these groups, their structure, their relation, and their interdependency and interaction. So pluralism say that instead of looking at a big macro structure, you should see small structure where there is also a lot of different relations. So in that case, society are distributed in different subsystems which all have power. The tendency of the system will be to distribute the power between these subsystems, and subsystem will be, we say, specialized. So, for example, we can have specialized subsystem as housing, public transportation, immunization, alcohol, sugar, cannabis, tobacco. All of these are different subsystems that have different topics. Subsystems can be big or small. That doesn't matter. They can be the size of a municipality, or they can be the size of a country. So there's thousands of subsystems in our society. Pluralism also say that the big political structure don't have the time, the expertise, and the attention to make decision in all of these subsystems. So, as to compensate that, they give to the subsystem a lot of liberty and a lot of power. So, in each subsystem, there's a small number of factors that will have lots of power. That's why Baumgartner and Jones call them mostly sub-government. So they are like a mini government. They used to be outside of political and democratic influence, these subsystems. So as first question, I will ask you, in the book of Baumgartner and Jones, how many of the subsystems remain stable during all of the nearly 90 years that they studied them? Well, okay, still counting. That's good. Well, a lot of people say that none, and you were right. So exactly, there's no subsystem that they saw that were stable during all of the study they made. What they see is that in a line of time, if there is stability, there's also critical events that will break down the stability of the system. And you can see in some subsystems, you can see a lot of these critical events. So the two authors say, well, our aim is to reconcile the long period of equilibrium that were very used in different models like incrementalism, and they were very known for that. But there's also sudden punctuation or sudden critical disruption of the system. So they want to integrate these two periods in one model. But still, the image you just saw was kind of simpler because the line of time was just flat. But in fact, the two authors also say that incrementalism is very important in these subsystems. What does that mean? That means that in the subsystems that are in equilibrium, you always have changes. The changes are small advances, and they work with marginal benefits. Okay, so that means that over a period of time, even if the subsystem is in equilibrium, you will see changes or evolution. Okay, so that's why in that graph the line are a bit well, they're not flat. Okay, there's still critical events. So in period of stable subsystem, the subsystem will be seen as a monopoly of power, and there will be also a very large consensus on the value. That's why one of the authors of incrementalism, who's called Lindblom, talk about partisan mutual adjustment. So in that period, the consensus, the value, the consensus about the value will say that people will accommodate and find solution between themselves. But there's still critical events that can attract the attention of macro policy environment. That means like prime minister and so on. Or and these critical events can take different forms, from scandal, crisis, natural disasters, or also strategic action of actors. So before going to the model, I also have to talk about conflict expansion. Conflict expansion is a very important notion in that theory, because that was first analyzed a long time ago by an author named Elmer Snyder, and he said that when you have a subsystem and there's a lot of participants that want to be associated with that subsystem, well, the chance that the subsystem collapse is increasing. So that was also completed. This work was also completed by Roger Cobbs and Charles Elder later on. So what does that mean? That means that you can destruct a subsystem by having more participants in a subsystem. One of the ways to increase the number of participants in a subsystem is having media attention. Media attention represents a risk for the subsystem in equilibrium, because when media attention is focused on one topic, well, there is people who will say, well, that topic interests me. That topic has a matter with me. So that's how I come to the first, let's say, practical insight on that model on public health practitioner, the importance of tracking media coverage. Media coverage is not just one thing, it's at least two different elements. First, media attention. So how many articles on the policy have been published, and is there an evolution in the number of articles observed? You can have some years that there's no article on one topic, and then there's an increase in the number of topics, of articles on that topic. Media tone is the second element to find in media coverage. What's the media tone is what is said about an issue, the perspective that is used by the media to observe, to analyze, and discuss an issue. So some question you can ask yourself is, do media reports support or oppose the existing policy? And is there also an evolution in the media coverage? So is there more like a negative tone article, or is there more like positive article tone? So that brings us to the second question, or the third. So in your opinion, what most threatens a stable subsystem? Okay. Well, thanks for your answer, and that's kind of interesting, because if we look just at Baumgartner and Jones, well, they will say that media attention is the main focal we have to see, because media attention will be the first thing to see before a subsystem crash or is in danger. Okay, media attention will be like an indication of a future crash of the subsystem, but still, you're right, most of people are right. Both are very important, in fact, because if we see some of, yeah, exactly. If you look at the graph there's you have before your eyes, well, you can see that that's a nuclear civilian power, and that's the number of articles. That's the dark one, and the light one, it's the positive, the percentage of positive article. And so you see that there's a lot of number of articles is increasing in the 1950s, but the percentage of positive article is decreasing by the same time. And it's really in the 1960s that you have a crash in, a punctuation in that subsystem. So you can say that both is important. The media attention is like an indication that it will occur. The media tone, you're really in the disruption or in the punctuation. So punctuated equilibrium is a model that uses exactly two key concepts. One of which is policy image. The second of which is policy venues. So we'll try to just make few comments about these two key concepts. First, policy image. Policy image is the way the public policy is discussed in public and in the media. So policy image is based, what they say, it's based on facts, okay? But a set of facts, different facts, and these facts will be interpreted by values and beliefs. So that means that facts can be distorted, like myths. We can have myths about public policy. These are good public policies. These are bad public policies. We can have a lack of awareness about the problem that we can have, the real impact of these problems. We can also demonize some actors that are in the subsystem because we don't like them, because they are not in our value. They don't act as our values ask them to do. So some of people also use the name of framing for the policy image, and I must say that it's usually about the same concept. Here. Other thing is that policy image in a subsystem, there can be a lot of different image in a subsystem. You can have a lot of different image at the same time. The tendencies will be to simplify these images by choosing one single images. That image, one single image. That image can be positive or negative. That will be one of the key concerns of the policy subsystem. Because if the subsystem is stable, the policy image will be positive. Okay? That's the focus. Okay, so in that time, the focus will be on positive facts, and the subsystem will ignore negative facts. Okay, the positive image will protect the subsystem, and during that time, well, the public, so the democracy and mostly the political party will lose interest in the positive image. They will not try to find solution to go against a subsystem that have a positive policy image. So in consequence, well, the subsystem will take a lot of their energy and their effort to strengthening their positive image. That will be called the defense policy. Okay, the defense of the policy, and during that time, because the effort is on maintaining your positive image, you might forget to resolve the negative facts that are in your subsystem, that are accumulating in your subsystem. So for that reason, there's a big warning in these subsystems that are in equilibrium. Well, if there is too much negative fact that are accumulating and they are not resolved, well, you can put your subsystem at risk of punctuation. The negative policy image will mostly be for the person that are against the subsystem. So as a new fact will be judged more negatively and will tarnish the policy image, you can be sure that there will be a lot of change in the environment that will change the image. So we talk about critical events like crisis, scandal, and natural catastrophes, but action of strategic actors are mostly important, and a lot of time it will be a combination of the two, like critical events and the action of an actor that will give the negative policy image a new twist. That's the way subsystems that were powerful and autonomous will lose their control to protect them, and then have a problem of equilibrium. So second practical insight, well, you have to analyze policy image. That's very important to analyze what's the image you have in your policy. So what's the overall image? What are the facts that play a role in this image? How do the facts are interpreted? And is there alternative image on that policy that you can find in the environment? So that's the third question. So can a public policy image change depending on the stakes concerned with an issue? Yes. Everybody say yes. Well, still counting. Well, okay. So we have a vast majority of yes, and that's nice because it's the real good answer. In the last century, you have the example of tobacco on your screen now, and on the last century, the two authors look about tobacco, and they found that there is a lot of different stakes that were found in tobacco industry, and for all of them, there's different image that were put in place. Like agriculture was depending on employment, and health was more like a disease or cost for health system. Insurance was more like the income, like the premium that you can have. Well, and international business talk about the exportation of the tobacco, leaf. Second topic is the policy venue. So policy venue is like, well, you have the definition there. So the institutional location where authoritative decisions are made. So we mean by that institution that can be seen as authority. In our society, we have a very large policy venues. We have different policy venues. We have to remember that the model was first published in USA, and USA is like the land of pluralism and also the land of check and balance. So, of course, over there, there's a lot of different policy venues. But here also in Canada, we have different venues. And policy venues are important because they might be interested in being associated with a debate or a team. So they can, sometimes they want to have the ability or to have the power to make something in one issue that concern them. Policy venues will have mostly two different roles. First, they can work as an actor, so they can say exactly what another actor of the policy system can do, like, for example, a municipal council that can introduce like how do I say that? That can ban something or make a resolution to ban something or to asking someone to ban something, like I don't know, a municipal council that asks for provincial government to put a tax, or they can also ban things. So have a real authority on an issue. So that brings us to the fourth question. Find the intruder. Which of the following institution is not a policy venue? Okay, interesting. Well, a lot of you say none of the above, and you were right. So all of these institutions can be defined as a public venue. There's a few of you that say that court cannot be a policy venue, but we often see court, well, in the USA it's most frequent, but also here we can use court as a way to get some information, some image, to change an image of an issue. So there's just two other slides for that presentation. So venue shopping, that's one of the important practical insights for public policy professional. So one of the way that the authors say that you should or could influence a subsystem is by shopping the venues. So trying to find new venues that will be interesting in your problem. So when you do venue shopping, it will be essential to understand the context and the decision-making rules of that venue shopping. So can they work in that topic? What are their targets exactly, and what are their objectives? Determine which policy image these policy venue will prefer to be associated with, because you still have the image to put across, and ensure that these policy venue have the will and the leverage to expand their field of expertise. Well, the will, they have to want to expand their competency, and the leverage is, if they can expand their competency, do they have the expertise to do so? Sorry. So that's the last slide of my presentation. In this scheme, you can find all the different policy image that you can find in natural subsystems. So a positive image, a policy image, a negative policy image, and a neutral policy image. At your right, you see the positive policy image. That's the way the subsystem works when it is in equilibrium. So you have a positive image. There's just favorite group that are in the subsystem. Their role would be to defend the defense of the policy, mainly by maintaining the positive image of the policy. That's what we call negative feedback. So when that happens, that's the incremental solution that are developed. And there is a negative policy image, so that's the discontent group, so people that are not pleased with the subsystem. Well, they have to do the strategic action. Well, first, try to modify the image. Second, they can also mobilize new allies because there's a lot of people that are neutral, that are indifferent or powerless group to the subsystem. So they can try to find if there is new ally that will be interested in working in that subsystem. So if in that logic it will bring what we call conflict expansion, what we call what we spoke earlier. And the last strategic action is the venue shopping we just talked about. So when we do venue shopping, there's a multiplication of policy venue that can bring on a punctuation because the policy venue will try to change the positive image of the policy and try to bring a new image of the policy. So for myself, it will be at the end of the presentation. Is there any question, Marianne?
Sorry, thank you for that, Mathieu. Yes, we've had a few comments and questions in the chat box. We can take about 3 minutes to answer some of them. If we don't have chance to answer all, perhaps we can provide answers on our webpage so that everybody has access to the answers. So the first question was regarding the importance of media coverage, and does this extend to things like social media?
Of course. Of course. Well, the author, the Baumgartner and Jones didn't exactly use social media, but now with the way the society is going now, it sure be one of the most interesting study element of media attention now.
Thank you. When you were talking about policy image, you mentioned the importance of fast, and one participant mentioned that in this era of Donald Trump, isn't it true that a public policy's image is based on falsehood?
Well, it can be based on falsehood, that's for sure. It can, yes, I must just say yes.
Thank you. When discussing critical events, a participant asked, what would you define as a crash? And is it always a negative thing? Or can it be an event that actually help, for instance, build healthy public policy?
Of course. Well, there is, of course, there is events that can be positive, and there is negative events that can have positive effects. Okay, mostly when there is a crisis, it's just say that the subsystem must have to go forward with a different solution. So in that case, even a bad event will have a positive effect on public policy. Yeah, I think, yeah.
I'm going to take one last question, and as I mentioned, because I want to have Jennifer time for her presentation, but we will post answers to your questions on our website. Matthew, can you say a few words on how does legalization of cannabis in Canada kind of fits into this theory? Is there any particular insights that you might want to provide?
I think that Jennifer will talk about that a little bit in her own geographic area. We also have a webinar in French next week with one of my colleagues from Montreal who will speak about that in Quebec. So it's kind of hard because cannabis was kind of a big issue for public health in the last year or so, and there's a lot of change in that subsystem. It's a subsystem that is trying to constitute itself, I will say. If you look at just the national level, I will say that for now there's a subsystem that is trying to put in place. That subsystem it's stable because the macro system is stable, but if there is a change in government, we cannot confirm that the subsystem will still be as stable as it seems now. But we have really a subsystem that is tried to put in place with different actors. Some actors don't talk to each other, but they sure have relation, and they sure have the same interest in that topic. I think about industries, but public health, principal agents like official from government. So there's really a subsystem that is trying to put in place right now.
So thank you very much for that. A lot of discussion we'll be following up through our website. So now I will hand it over to Jennifer Levy from Toronto Public Health. So Jennifer, please go ahead.
Thank you. Good afternoon. First, I'd like to introduce and situate myself. My name is Jennifer Levy. I'm a Policy Development Officer and the Healthy Public Policy Directorate at Toronto Public Health. I've been doing healthy public policy work for over 7 years, and I participated in diverse research and policy projects, from working on interventions to improve the food environment, to examining racialization and health inequities, to developing an approach to informal breast milk sharing. At Toronto Public Health, I'm part of a team that works to advance healthy public policy on a broad range of issues. So these include climate change, the built environment, transportation, housing, social inclusion, and community violence, with the goal of reducing health inequities and improving health. So I was asked to speak about the punctuated equilibrium model from a local public health perspective. Today I'm going to do some ground truthing of the punctuated equilibrium model. I'm going to share my reflections on the extent to which the model speaks to the work that I do and what insights the model offers for action. As well, I'm going to talk about the parts of the model that don't resonate as much with my work. Throughout, I'm going to weave in 3 examples to illustrate the points that I'm making. I'll talk about drug policy and supervised injection services, tobacco policy and multi-unit dwellings, and menu labeling. So I think one of the things that the model can encourage is reflection on where it is that we as public health actors are located in relation to the policy issues we are interested in advancing and the venues through which we can advance our policies. So where are public health actors located? I think the answer varies depending on the issue. For the vast majority of issues that we deal with, particularly those that are firmly within the purview of public health, we are members of the subsystem. So for example, here I'm thinking about vaccination policy or water fluoridation policy. However, when we start talking about healthy public policies and bringing a health goal to other policy venues, We are most often no longer part of that subsystem, and here I see that public health could then be viewed as the discontented actor. So I want to ground these points with a couple of examples. Oops, sorry. First, in working to create smoke-free policies in multi-unit dwellings, PPH was not acting in a public health subsystem. While from a public health perspective, tobacco control is firmly within the public health subsystem, and in public health we certainly view housing as a social determinant of health. In looking at tobacco control within social housing, we had entered a different policy venue. Within that subsystem, and from a social housing policy perspective, health was an outside voice. Our public health advocacy for smoke-free multi-unit dwellings challenged some of the values within the social housing subsystem, including tenants' rights over their own domestic sphere and equal rights for tenants without other housing options to be able to smoke in their homes in the same way that others have the right to smoke in their homes. As public health, we emphasize the need to balance competing rights, one's right to breathe clean air and another's right to do what they want in their own private space. Second, in relation to developing policy to advance a public health approach to drug use here in Toronto, we see public health as oscillating between multiple positions. This has happened both over the long course of policy development and change, as well as depending on the policy venue. So on the one hand, in this advocacy, we have taken on the role of the discontented group, advocating to the federal and provincial governments for a public health response to drugs, calling for federal policy to allow supervised injection services, funding for these services from the provincial government, and most recently for the decriminalization of all drugs. On the other hand, we are firmly part of the subsystem that delivers public health services for people with drug use issues within a harm reduction framework. And as a member of the subsystem, we are pushed by activists as the discontented group who would like to see a faster and more extensive response to the opioid crisis. The establishment of an illegal supervised injection site in Moss Park in the summer of 2007 turned out to be a successful tactic by activists in speeding up action. So the punctuated equilibrium model also asks us as public health or local public health to consider and reflect upon the multiple venues available to advance our policy interests. I find that local public health location in relation to multiple policy venues is a double-edged sword. On the one hand, our sphere of control is very limited, particularly with respect to advancing healthy public policies, which are often situated within venues over which we have little control. On the other hand, we are relatively unconstrained in our opportunities. We have the opportunity to work through multiple policy venues to advance our policy issues. At the same time, the Board of Health can be a public forum for policy issues, and the Medical Officer of Health can be a strategic actor and agent for change for a policy image. In Toronto, we have a semi-autonomous Board of Health, and through the Board of Health, we can bring policies forward to City Council. We can advance multiple municipal policies through this channel if we can garner the support of City Council. We can also advocate through the Board of Health for action at the provincial or federal level. For example, in 2011, Toronto Public Health started to explore menu labeling as an initiative to encourage informed dining options. We went to the Board of Health with a proposal that recommended the province of Ontario establish menu labeling, and we provided the province with a deadline for action, communicating that if there was no provincial action, Toronto Public Health would explore a municipal menu labeling bylaw. For this, we had the opportunity to bring menu labeling to municipal policy venues. Subsequently, the province enacted menu labeling legislation. We at Toronto Public Health have tended to address our policy advocacy to the venues that seem most inclined towards the policy direction we are trying to advance. And in the last several years, we have seen shifts in the level, federal versus provincial, to which we have directed our policy as the party in power has changed. This has required us to reframe our issues and reorient our approach. For other policy issues, like drug policy to respond to the opioid crisis, we've needed policy change at all three levels of government: an exemption under the Controlled Drugs and Substances Act, funding for the province for supervised consumption services, and support from the Board of Health and Toronto City Council. I also have a circle on the side for other policy venues, and there's a lot of opportunity to drive local policy action through other policy venues. For example, Toronto Public Health has been working in this domain to advance smoke-free policy in multi-unit dwellings. We've been working with Toronto's social housing provider, Toronto Community Housing Corporation, which is a quasi-municipal government body, as well as private landlords and property management firms. So I want to move on to provide some examples of how we have worked to frame policy issues and how different framing has helped to move policy issues forward. So on the slide are examples from a campaign we launched while working on menu labeling policy. Menu labeling has traditionally been framed as a nutrition issue. While this campaign did focus on nutrition, it also highlighted consumers' right to know what is in their food, to be a savvy diner and make informed choices. This right to know approach resonated with residents based on the feedback that we received. Secondly, in relation to our work developing policy for smoke-free multi-unit dwellings, cannabis legalization created a push and different framing for the policy. Cannabis legalization changed the framing of smoking within multi-unit dwellings. Smoke-free went from being something that was problematic to something that was desirable, and housing providers seemed to become more receptive to going smoke-free than they had been previously. Toronto Public Health intentionally took advantage of the shift to raise the stakes with landlords to have them see the value of a smoke-free policy. For over a decade, Toronto Public Health has been advocating for a public health and harm reduction approach to drugs. As this article from 2010 highlights, this policy image is in contrast to a crime and justice war on drugs approach that had been the dominant policy image in Canada and still continues to dominate in many international settings. So finally, I want to turn to the punctuated equilibrium model as a whole and think about its utility in guiding reflection about policymaking and local public health action. I think this model can be helpful to understand policy issues. I think retrospectively we do see this type of punctuated equilibrium model for many policy issues, particularly if we take a long view. However, I'm not sure the extent to which we can see equilibrium and punctuations in lived time. And as a model, it doesn't capture all of the messiness of policy change. First, using the model as a basis, most of our action most of the time would be characterized by equilibrium and stability. I think that the challenge for us as policymakers is to think about how we can continue to move our agendas forward within those stable periods. Here, I think it's helpful to think about how we may differently frame our issues to perhaps capitalize on what is currently occupying the public discourse and decision makers' attention. Secondly, even so-called critical events and punctuations are often quite long, drawn out, or incremental. There's also a certain amount of happenstance in policy change in our government system where we sometimes need policies to line up from all three levels to create change. For example, the shift in drug policy that led to the opening of supervised injection services in Toronto in 2017 may be considered a punctuation, with critical events including the 2011 Supreme Court ruling, the opioid crisis, and the illegal supervised injection site opened by harm reduction activists in the summer of 2017 in Moss Park. At the same time, the policy shift was the result of more than a decade of incremental work, action, and planning by the Toronto Drug Strategy, whose work started in 2005 to establish an evidence base, conduct a needs and feasibility assessment, and develop a toolkit. Beyond this strategic policy work and being ready with a solution when the crisis emerged, establishing supervised injection services required the right timing in terms of federal, provincial, and municipal politics. A third comment that I would make is that, of course, critical events or crises, particularly issues that capture significant media attention, often lead to hastily developed solutions and some bad policy trajectories. So to briefly conclude my reflections, the punctuated equilibrium model can provide those working in local public health with a model to think about and reflect on a policy issue and use the reflections to inform strategic action. At the same time, we need to be mindful that policy making is often less linear and straightforward and more complicated and messy.
Thank you very much for that, Jennifer. I think it highlights the gap, or the relevance, but also the gap between practice and science. So thank you very much for that. Unfortunately, we won't have time to take questions. We're at the hour. I want to thank Mathieu, Jennifer, and Mylène for their work on this webinar. The recording from this webinar, PowerPoint presentation, and answers to specific questions will be posted on our website. You will be receiving by email a link to that, as well as a link to our evaluation form of this webinar and information to obtain your continuing education credit. So thank you again for joining, and